morning. Hope you're well. I'm well myself. I welcome you back to my YouTube channel. My name is Jamie Naftali. I am a pediatrician by profession. This channel is on kids' welfare. Here I do educate the mothers. I provide the knowledge on common illnesses affecting children while growing up. This is the only channel whereby mothers get to be informed in layman language, in a language that they can understand what really happens to these children while growing up. To try and understand, I want to involve everybody into the management of these babies. So welcome into yet another episode. I know it has been a while, so let's go direct to the video. And before we go to the video, if you haven't subscribed, please hit the red button, subscribe to be part of us, to be part of this wonderful family. Yes, this is a family. Join the family by hitting the subscribe button. So we are road to 5k subscribers. I know this is very possible, guys, so please let us reach 5k subscribers. If you're that returning subscribers, thank you so much. You are a favorite person. You don't even know it yet. Thank you for always coming back to watch my content. Thank you to everybody who gives feedbacks, either in the emails, in the comment sections, giving my videos a thumbs up. Thank you so much. I really appreciate. So let's go to the video. And the video of today, we want to do triage of sick children, or triaging the sick children. So what is the meaning of triaging? Triaging is like sorting out. Yeah, imagine in a pediatric emergency center whereby all babies are brought. They are very sick, all of them. So this is how do we make the decision on which babies to start with, which ones are we supposed to start with in terms of treatment, and other than others. So this is what triaging is more of sorting out. We want to separate the very sick babies and these babies that don't need emergency priority. So then we have three major categories. We have emergency signs, babies with emergency signs. These are the babies that you want to start with. I'm saying imagine in a setup whereby it's a pediatric emergency unit and the babies are all over sick with their mothers. So I want us to know and to sort out which babies to go for first and the signs we look for so that we can attend to them. So we are saying we have three broad categories. We have babies with emergency signs. We have what we call the non-emergency signs. We also have what we call babies with priority signs, the priority signs, and we are going to see in each categories what we are talking about. So like we are saying, triaging is like sorting out, yeah, the sick babies. So let's start with the emergency signs. What are these emergency signs that we look for and which we want to start to approach these babies, or we want to start attending to these babies? So babies with emergency signs, we first check with remember our ABCD. We have talked about it previously in our previous episodes in conversions and all those videos. So ABC is not a new term. If you have been following, if you're my follower, ABC is not a new term. So we start with ABC, and A we say stands for airway. We have B for breathing and C for circulation. So these are the things that we want to check in emergency signs. So if airway is obstructed, if we have got obstructed breathing, this baby is not able to breathe so well. There is some obstruction. So this one, we say that the airway is interfered with. We also have central cyanosis. Remember, cyanosis, we say it's a blue discoloration of the skin, the extremities, and also the skin, even on the tongue. So central cyanosis, that blue discoloration, it's just it's a sign that we do not have enough oxygenation. So central cyanosis is another sign, emergency sign. If this baby has got severe respiratory distress syndrome, again RDS, respiratory distress syndrome is not new to this channel if you have been following. So these are issues with breathing. Again, you find that babies are having difficulties in breathing. They have got fast breathing, then they have got things we call lower chest wall in drawing. We said you can easily count the ribs, so when the baby is breathing, so counting of these ribs, this shows that this baby is training to breathe and they are using other muscles. We call them the intercostal muscles to breathe. So these are signs of respiratory distress syndrome. So what are we saying? We are saying that if a baby has got severe respiratory distress syndrome, this is an emergency sign and we should treat this as an emergency. Now, if they have got weak or absent breathing, you find that babies are breathing so weakly. So the respiratory rate is there but from far. So this is a baby that needs emergency attendance. Yeah, so that is about A and B, the airway and breathing. How about circulation? What is emergency in circulation? If the child has got cold hands, if the hands of these babies are very cold, especially on the extremities again, these are the extremities. So babies normally should be very, very warm. Yeah, if they have cold hands, also the capillary refill is more than 3 seconds. What do we mean by that? Capillary refill is this: when you press this, so the blood should come back immediately and it should be less than 2 seconds. But in cases whereby this is what we call the capillary refill, when you press like this. So if you press and it takes time for that blood to come back, it takes more than 3 seconds. This is what we are saying. That delayed capillary refill is a sign that the circulation is interfered with, and it's not a good sign. We are saying it should take less than 2 seconds. Yeah. If they have got weak plus fast pulse, so if you feel for the pulse, either here, the pulse is very, very weak, or sometimes it's not there, you're straining to find the pulse, it should be pulsating so actively. So if you press like this and the pulse, you cannot be able to feel it, or it's very weak, then this again are a sign that the circulation is not so good. If they have got slow or fast pulse. So if all these we said in airway, breathing and circulation, if you have got all these things we said, what you do, you need to transfer this baby to emergency area. So immediately transfer, don't waste time. If the ABC is compromised with the things that we have just said, what you do next is you immediately transfer these babies to the emergency area. Yeah, so here you want to start life support. So if you want to start opening the airway, you want to start ensuring that the breathing is okay by baby giving the rescue breath. This is what we call the life support. So you may need to give these babies oxygen in most cases. Yeah, so try to do all these things. Monitor the vital signs very, very closely, the SpO2, the oxygen saturation. Yeah, so this is what you do. So you immediately transfer these babies to an emergency area. So you do all these things, start the life support. Like we are saying, you might need to give oxygen and all this. So that is about the emergency signs you have mentioned. Other emergency signs is if a child is in a coma. The child are having convulsions. Remember the tremors that we said, child convulsing. If they are confused, and here to assess if the child is awake, we use the AVPU. Again, not new. Go back to my previous episode where we talked about the AVPU. This is the one that is used to assess the consciousness of babies. The AVPU, A standing for alert, if the baby is alert. V is the baby responding to voice. P is the child responding to pain. U is the baby unconscious. So in case the AVPU is less than A or is at P or U, meaning they are not able to respond to pain and they are unconscious. So these are babies again that we need to transfer them. This is a baby in a coma. We need to transfer again all these babies that are in a coma that have convulsions and the AVP less than A. We want to transfer them again to the emergency area and do the life support. So all this is what we are calling emergency signs. Yeah. How about we have another category we call priority signs. So you want to pick babies with these signs, the priority. We want to prioritize this baby other than any other baby in this emergency, a pediatric emergency unit. So what are the priority signs? Which babies do you pick first when they are sick? First, we want to treat the very tiny babies. These are the infants, sick infants, and these are babies that are below 2 months. So if the baby is below 2 months, very tiny, and they are sick, these are babies that you give the priority to. Yeah, that is number one. Another priority sign, the temperatures. If they have got high babies with very high temperatures, that is temperatures of above 39 to 40 to 41. So above 39 degrees Celsius, you want to prioritize this baby. You want to pick them, sort them out from other babies, and you want to start treating these babies before any other baby. A child with trauma, major trauma, maybe they have been hit or there is a blow on the head and the baby is unconscious again. So trauma, every trauma, please treat this baby as a priority. This is a priority sign, the trauma. Other things is a child with very severe pain. Pain is a priority sign again. So if the baby is in so much pain, you need to treat these babies as a priority. A baby, you give them the first priority. We have poisoning. So the mom reports the baby to have, for example, taken like some kerosene, for example. We have done again a video on poisoning. Go back to the videos I did on poisoning so that you can understand these things. So if a man reports poisoning, so then poisoning is a priority sign. You need to prioritize these babies again. Pallor, we have got severe palmar pallor. Pallor this is a palm. So severe palmar pallor is when the palm is so pale. Pale in terms of it's very white. In the usually the baby should be just nicely pink. When you press again the cup refill, like we said, the blood should come back immediately. But you find that they have got, it's a bit white instead of pink. So this is a palmar pallor. Again, this is a sign that the blood, we have got low blood levels in their blood. So normally this is what we call the pallor. Again, pallor is a priority sign. Prioritize these babies with a severe palmar pallor. Other things, we have babies that are restless, irritable, and very floppy. Very floppy. So the baby is just crying, very irritable. They just don't even breastfeed. They don't feed. They're just irritable. And the tone when you get hold of their heart is just floppy. This is a baby that you should give a priority. You should give a priority. So this is a priority sign again. If a baby is a referral, they have got an urgent referral letter. So they have come to the facility and this baby, the mother was in another hospital and they are written a referral letter. So referral always shows us that this is a serious case. So you need to go and give this a priority if the mother has got the referral letter. Babies with malnutrition, and these are babies with severe visible severe wasting. The babies are so wasted. We have done videos about the malnutrition, guys. Go back and read about malnutrition. Still in my videos, I have got like 4 videos on malnutrition. Yeah, so go back there. They have got, we say they present with very severe wasting. So these muscles here are very thin. They are very wasted. The buttocks also very wasted. Even the chest, everywhere is wasted. So babies who are severely wasted, they have got malnutrition. You want to give this child a priority when it comes to treatment. So this is again, malnutrition is a priority sign. Yeah, if a baby has got edema in both legs, the baby has got swollen legs, both of them, edema again is a priority sign. You need to give this baby first priority before any other child. Yeah, if the baby has got burns, and these are very severe burns, maybe the percentage is so big, I'm going to do a video on burns, how we calculate the percentages of burns. So if the baby is severely burnt, this one is a priority. So you need to give this child a priority. So all those things are priority signs, the ones we have talked about. What do you do about them? So you want to place them in the front of the queue. You want to place them in front of the queue before any other baby. All those priority signs you have talked about. So you do clinical, they need clinical review as soon as possible. This is not a baby that you need to waste time about. So they need a very fast clinical review. So weigh this baby. So do the baseline observation, take, like for example, take the vital signs and try treating these babies. So anything else not in emergency signs, like we said in ABC, not in the priority sign. Now this is an urgent, non-emergency signs, so these ones can come later. So the triaging of the sick children basically means that you want to sort out the very sick babies from those that are not very sick. Yes, they need care, other babies, those that do not have the urgent signs, they don't have the emergency signs rather. So they need care, but you need your care, your priority should go back to the emergency and also the priority signs, the ones we have talked about. I hope this is very clear. I thought it was good to make you know, so that you know that when babies come to hospital, we just don't attend, especially where there are very big number of children. Very big numbers of children. There are ways that we sort out these babies, ways of approaching their treatment. We just don't go to any baby that came before the other. So this is what we follow, the triaging these sick babies. Now you know. Thank you for always keeping tuned. If you have got any questions, go to my email. My email address is provided in the end of every video. Go there, ask any question, comment in the comment section. Remember guys, also to give this video a thumbs up. Also, if you haven't subscribed again, subscribe to be part of us. We are saying we are road to 5k subscribers, which is very, very possible. I believe so. We are now almost 2k subscribers. I know very soon we are going to hit the 5k subscribers. Thank you so much. Till the video, until the end, ask the questions and turn on your notifications also to know every time I'm posting a new video here. Thank you so much. Till next time. Bye bye.